Good morning, Dr. Hartman.
Hey, hi,
Hey,
Elena.
today I just want to talk about a little bit about rhinoplasty, the
Great,
process and
great topic.
expectations for
Okay,
that.
perfect.
So, our first question is, what is a rhinoplasty?
So it's very important to know what a rhinoplasty is capable of and what it's not expected to do. So rhinoplasty is a surgical procedure. It's a nose job, as other people call it. Most of the rhinoplasties that we do are called open. We make a little incision and lift the envelope of the nose and then do work. It's designed to address specific problems. So there may be a bump on the nose. It could be some problem with the tip here. But what it's not designed to do is make a quote unquote perfect nose. So generally, if you look at the spectrum of problems that a nose might have, it's going to address several of those problems, one, two, three of those problems. But it doesn't by any rhinoplasty surgeon, guarantee that you're going to have a quote unquote perfect nose. And even though we have this term plastic surgeon, plastic is actually a Greek term meaning to change. It's not like the nose is like a lump of clay that we can perfectly sculpt a nose. It doesn't work that way because it's a living part of a body that has to go through its own healing, uh, and it has its limitations about what's already there. So, but we can very successfully address specific problems and make improvements on those specific problems. That's what rhinoplasty is. It's a great procedure as long as you're very clear that it does specific improvement, but it's not designed to make a perfect nose.
Right. So, what is achievable then during a rhinoplasty?
Yeah, so
and
typical
after?
things that people talk about or want improved is they have a hump on their nose and they want to have that reduced, and that's a fairly straightforward process. Now there could be limitations on how much you can do with that in a single procedure. Many times people have sort of a boxy or bulbous nose if they want some improvement in the cartilages of the nose, and that's very achievable. You can have what's called a hanging columella, where this part hangs too low. So again, it's a specific issue that can be addressed. But to think that you're going to take my nose, for instance, and make the um, you know perfect movie star nose out of it, that's probably not achievable. And you want, again, like Michael Jackson, you want to know that you don't try to push it too far, right? You can't. There are limitations of what can be achievable.
Okay, great. So, you said what is not achievable also?
Yeah, so the nose it's there for a function. It's there to help us breathe, right? And so there are support structures in the nose that you have to continue to respect. So we can't sometimes take things farther than the anatomical structural limitations of the nose allow us to do.
Okay, great.
Yeah.
So, what is the process of healing after your rhinoplasty?
So, like anything, any type of a surgery a person's going to have, there is a period of inflammation. So the immediate phase of inflammation peaks at around day 3 or 4. So there could be swelling of the nose, certainly. There can even be swelling under the eyes, one or both of the eyes. You could have swelling of the upper lip. You could have swelling up in the forehead. So that period peaks at around the third day and then gradually improves throughout the first, second, and third week. And that's going to be about 70 to 90% of the inflammation that occurs after rhinoplasty. There's always going to be some inflammation after rhinoplasty. Inflammation is part of the healing process. Is when our body recruits the appropriate cells and bio messengers to cause new blood supply to come in, and the cells necessary to clean up debris from the surgery and to begin to weave in new elegant sheets of support and fascial tissue in the nose. So that's a very important part of any kind of a surgery, is the healing process, the inflammation process. So that inflammation is generally 70 to mostly 90% gone after about 3 weeks. And by that time, the nose is very much looking like what it's going to. But that last 10% takes up to a year to resolve. So there will be some thicker parts of the nose that take up to about a year to improve. There's usually some tiny little stitches somewhere if it's an open rhinoplasty, and those come out in about a week, and they're very, very small. Sometimes we can laser any type of incision and say, That's very discrete placement of those incisions, and they're almost never noticeable. About 2% of the time are they noticeable, and only about 1% of the time after rhinoplasty is it significant enough that it bothers the patient. But that's a possibility too, that there be a scar, usually right in there, in narrow heart of column. It's also sort of an irregular scar, like called a gall wing incision sometimes, or a step off incision, so that it very much doesn't catch notice.
Okay, great. So what should we expect after having a rhinoplasty then?
So the initial issue of discomfort generally mostly resolves after about 2 days, a day or two. So there is some pain, if you will, or discomfort that's going to be there for the first day or so. Now, we don't do narcotics in any of our practice anymore. It's become a scourge on the American culture as narcotics, and studies actually show that if a person has surgery, their pain course after the surgery is worsened by using narcotics. So you can do much better by just doing nothing, maybe some cold bag of peas on there or some Tylenol or Motrin, but it's better not to use narcotics, and we don't in our practice. But generally, the worst of the discomfort is there for the first day or so, and then there could be some other discomforts that's sort of mild and very manageable, not really noticeable except if you sort of push on it. It could be there for days to weeks to maybe even a month or so. But the other thing that's kind of noticeable in a rhinoplasty, especially rhinoplasty, open rhinoplasty, where it's lifted up and worked on that way. You can also do work from inside the nose in some cases. That's called a closed rhinoplasty. But is that the tip of the nose often will be somewhat numb for weeks to months afterwards. That those sensory nerve has to reintegrate, and so that's very common.
Okay, great. Thank you so much, Dr.
You
Hartman,
bet,
for
you
all
bet.
that information.
You bet,
Yes.
And so at our practice, we're always here before, during, and after any kind of procedure, and we're available for texting conversations, or and we want to keep you in the loop. So that's always part of it anyway. Even though we're trying to address common things right now, is that we're here for you afterwards to make sure that your course after rhinoplasty is as smooth as it could possibly be.
Okay, great.
Yay.
Thank you
Great.
so much.
Thanks, Elena.
Bye.
Bye.